Imagine a stack of marshmallows between building blocks. That's a simplified way to picture your spinal discs. These discs, sandwiched between your vertebrae, the building blocks of your spine, are crucial for movement and shock absorption. They act like cushions, allowing us to bend, twist and move with ease. Without them, even simple actions like walking would be incredibly painful. These discs have a unique structure. They possess a tough outer layer called the annulus fibrosus and a soft gel-like center known as the nucleus pulposus. Think of a jelly donut. The annulus is the doughy part and the nucleus is the jelly filling. This structure is key to how discs function, providing both strength and flexibility. As we age, our bodies change and our spines are no exception. Just like our skin loses elasticity over time, so do our spinal discs. This aging process is a natural part of life, and it affects the disc's structure and composition. One of the key changes is a decrease in water content within the nucleus pulposus. Remember the jelly donut analogy? Imagine the jelly drying out a bit, becoming less plump and more viscous. This happens in our discs too. As the water content decreases, the discs become less flexible and less able to absorb shock effectively. This loss of water content also affects the disc's height. The discs become thinner, which can lead to a slight loss in height over time. This is one reason why older adults may notice they are a bit shorter than they used to be. While some degree of disc degeneration is a normal part of aging, sometimes this process accelerates, leading to a condition called degenerative disc disease, or DDD. DDD is not simply wear and tear, it's a complex process involving biochemical and structural changes within the disc. In DDD, the changes that occur with normal aging are amplified. The nucleus pulposus loses even more water content, becoming more like a dried out gel. The annulus fibrosus, the tough outer layer, can weaken, develop small tears or even bulge, potentially pressing on nearby nerves. It's important to remember that not everyone with age-related changes in their spine develops DDD. Many people live long, active lives with these changes. However, understanding the difference between normal aging and DDD is crucial for proper diagnosis and treatment. Doctors use various imaging techniques like X-rays and MRI scans to diagnose and assess DDD. These images can reveal characteristic changes in the spine, helping to differentiate DDD from other conditions. One common finding is a narrowing of the disc space between vertebrae. Remember the shrinking discs we talked about? This narrowing is a telltale sign of degeneration. Another key indicator is the presence of bone spurs called osteophytes. These bony growths develop around the edges of the vertebrae, often in response to disc degeneration and instability. While radiological findings are important, it's crucial to remember that they don't always correlate with pain levels. Some people with significant disc degeneration on imaging may have minimal symptoms, while others with mild changes experience significant pain. Section 5. The chemistry of degeneration, proteoglycans and disc health. To understand degenerative disc disease, we need to delve into the fascinating world of biochemistry, specifically the role of molecules called proteoglycans. These complex molecules are like tiny sponges residing within the nucleus pulposus, responsible for attracting and retaining water. This water-binding capacity is crucial for maintaining disc height and cushioning ability. In degenerative disc disease, the production of proteoglycans decreases and their structure changes. Imagine those tiny sponges becoming less efficient at holding water. As a result, the nucleus pulposus loses its gel-like consistency, further compromising the disc's ability to absorb shocks effectively. This biochemical shift within the disc is a key driver of the structural changes we see in degenerative disc disease, such as disc narrowing and bulging. Understanding the role of proteoglycans helps us appreciate the complexity of this condition and explore potential therapeutic targets for treatment. Section 6. Cracks in the armor, tears in the annulus fibrosus. Remember the annulus fibrosus, the tough outer layer of the disc? In degenerative disc disease, this protective layer can weaken and develop tears. These tears can be radial, circumferential, or a combination of both. and they can vary in severity. Radial tears, as the name suggests, extend radially from the center of the annulus outward, like spokes on a wheel. Circumferential tears, on the other hand, run along the circumference of the annulus, like a cut around a tire. These tears compromise the annulus's structural integrity, making it more susceptible to bulging or even herniation. Imagine a tire with small cracks or cuts in it. While it might hold air initially, it's weaker and more likely to fail under pressure. Similarly, tears in the annulus fibrosus weaken the disc's ability to withstand mechanical stress, increasing the risk of further degeneration and pain. The weight we carry, mechanical load and disc degeneration. Our spines are constantly subjected to mechanical forces, whether we're sitting, standing, or lifting heavy objects. While our discs are designed to handle these loads, excessive or repetitive stress can contribute to degeneration, especially in individuals with pre-existing DDD. Think about a trampoline. Jumping on it occasionally is fine, but constantly bouncing on it will eventually wear it down. Similarly, repetitive stress on the spine, such as that experienced by athletes or people with physically demanding jobs, can accelerate disc degeneration. Maintaining a healthy weight, practicing good posture, and using proper lifting techniques can help minimize mechanical stress on the spine and potentially slow the progression of DDD. The DNA blueprint, genetics, and disc disease. While lifestyle factors play a role in DDD, genetics also contribute to an individual's susceptibility to this condition. Just like we inherit our eye color and height from our parents, we also inherit genes that can influence the health and integrity of our spinal discs. Research has identified several genes associated with an increased risk of developing DDD. These genes can affect various aspects of disc biology, such as the production of collagen, a key structural protein in the annulus fibrosus. Understanding the genetic component of DDD is an active area of research. As we learn more about these genetic factors, it may pave the way for more targeted and personalized approaches to prevention and treatment. DDD in action, real-life examples and experiences. Let's put a human face on DDD by considering some real-life examples. Imagine a 55-year-old construction worker who has been experiencing chronic low back pain for several years. His job requires heavy lifting and repetitive bending, which has likely contributed to his DDD. Or consider a 60-year-old marathon runner who develops neck pain and headaches. While running is generally considered a healthy activity, the repetitive impact on the spine may have accelerated disc degeneration in her neck. These examples highlight how DDD can affect people from all walks of life and activity levels. It underscores the importance of early diagnosis, lifestyle modifications, and appropriate management strategies to maintain spinal health and quality of life. Navigating DDD treatment, prevention, and outlook. Living with DDD can be challenging, but there are ways to manage symptoms, slow its progression, and maintain a good quality of life. Treatment options range from conservative measures like pain medication and physical therapy to more invasive procedures like surgery. Physical therapy plays a crucial role in DDD management. It helps strengthen muscles supporting the spine, improve flexibility, and reduce pain. Medications such as over-the-counter pain relievers or prescription muscle relaxants can provide symptom relief. Prevention is always better than cure. Maintaining a healthy weight, engaging in regular exercise, practicing good posture, and using proper lifting techniques can all help protect your spine and reduce the risk of developing DDD. While DDD is a progressive condition, it's not a life sentence for pain and disability. With proper management and a proactive approach to spinal health, individuals with DDD can live full and active lives.